Hey there, how's everyone doing? This is Dr. Jason Kim from New York. We are on our YouTube channel. Thanks for joining us. And so for today's episode, I want to kind of discuss about some of the steps that we do to give you a much better, healthier, natural, aesthetic looking smile. So for patients who are looking to do some cosmetic treatment, there's some steps that we need to do before we do the actual procedures. Now what we do is we need to do what's called a wax up, meaning we'll take a scan or an impression of your mouth so that we can see what your teeth look like. And so if you look at my laptop here, we have an impression that we took using our scanner. I spoke earlier in some few episodes earlier about intraoral scanning. So I can take my scanner, take a picture of the patient's mouth, and we can use that information to make a model to really evaluate what our goals are going to be in terms of aesthetics, function, and being able to kind of give us a beautiful, healthy smile for our patients. So once we have this model, we can do what's called a diagnostic wax up. Now, diagnostic wax up, what that is, it's actually showing us what the final end result's going to be, because we need to picture what the final goal is, right? What the final results are going to be for the teeth. And so we use that tool. We use this model, and then we can use that to fabricate what's called the diagnostic wax up so that we can kind of show the patient what we're looking to achieve in terms of goals of improving the teeth in terms of aesthetics, function, and the smile. So we could use this information to help guide us to get to our final goal of beautiful looking healthy teeth, whether it's with veneers or crowns, or sometimes we have to incorporate maybe some orthodontic treatment. But using the diagnostic wax up enables us to see the final goal before getting to the actual procedure so that we can plan accordingly. Because a lot of things that we do in dentistry has to start with the final restoration, final goal, final smile, so that we can come up with a plan that's going to help us get to that final product in a more efficient, more predictable, and a very successful manner. Because we want these crowns, we want these veneers to last for years and years. On average, how long should these crowns and veneers last? I would say at least 10 to 15 years minimum, right? If it's done properly and we understand the function and we understand how the bite really needs to be attended to, a lot of these restorations, a lot of these smiles can last for 10, 15 years. And we say that because we know nothing lasts forever, but 10 to 15 years should give us enough time in terms of function, aesthetics, and then whether it needs to be replaced at that time, we can evaluate it again at that time later on. But our goal is to really give patients a healthy, functional, aesthetic looking smile, and we can do that by using the technology, as I mentioned, with the intraoral scan, but with the diagnostic wax up, because that gives us the final goal of what we're looking to achieve as a result, because we need to see that blueprint. And that's what we do today, right? Whenever you go to a restaurant or you're going somewhere, what do you do to your GPS? You put in the final address, right, to come up with a plan on how to get there. Same thing with dentistry. We need to know what the final goal is. What's the final restoration going to look like? And then come up with a treatment plan. So hopefully, if that helps, allows you to kind of think of what your goal is going to be, discuss that with your dentist, and then come up with a treatment plan that's going to give you the best healthy, functional, aesthetic looking smile. So thanks for joining us. We'll see you next time. Like us and subscribe to us.